So I'm going to start this treatment with some soft tissue release or pin and stretch, and we're focusing on the hip rotators here, specifically piriformis. So soft tissue release is a very simple technique which focuses on a strong local stretch to the muscle fibers. So the way in which we do this is we shorten the muscle, lock the muscle off, lengthen, and then we release. So shorten, lock, lengthen, and release. As I said, this is really good at breaking up kind of like local adhesions and scar tissue. Now you can do this either passively or actively. So passively is when I am actually moving the limb. Actively is when the client themselves actually move the limb. As you can see right now, so this is now an active soft tissue release, and I can become specific with where I want to kind of apply this soft tissue release now. So I found an area of tightness on the hip rotator here, and I'm focusing in on this point with my thumb. So changing position, you may want to do this from the other side, and you can use your elbow as a lock. Now with this I can actually use my body weight just to go slightly deeper if that would be necessary. And again, we're shortening the muscle, locking it off, lengthening, and then releasing. Just be aware that soft tissue release can be quite painful for the client, and if it is too painful, just ease off with the pressure slightly. Another technique that can be used is positional release. So here what I'm doing is monitoring the pressure in the gluteus medius and gluteus maximus muscle, and then just taking the hip through extension and flexion. You can get a greater range if you have the leg being assessed or treated just hanging off the couch slightly. So here I've just moved the client into sideline position, which is really good at just looking generally at the gluteal muscles and those kind of deep hip rotators. So at the moment I'm just getting a broad aspect of any areas of tightness or discomfort, just using my fingertips, not applying too much pressure, just to locate those areas. Once you have an area of tightness or kind of symptoms of discomfort, you can start to use a broad forearm and then finally using your elbow just to kind of put some pressure into those places. Now remember, the gluteal muscles are on stretch now, so the sciatic nerve area is kind of protected by the muscles, so do not worry about going in too deep there. Your client may also experience some referred pain just shooting down the leg here, so you can just kind of sit on that area going backwards and forwards to ease their symptoms. Whilst you have your client in a sideline position, you can then get them passively to hip flex and apply pressure to a stretched gluteal area or gluteal maximus muscle, using your elbow, your knuckle, just providing some circular frictions, transverse frictions to any areas of discomfort or adhesions. With all of these techniques, you just want to use a technique that you find comfortable. Don't put yourself in any positions that cause you pain or discomfort. Just make sure what you decide to use, whether it's your knuckle or your elbow, it's comfortable for you. You can also then support the leg, for example on this video it's the right leg, with your hand, keeping it in that set position so you can really work deep into the fibres of the tissue. You can also do some soft tissue release in this position, specifically to the gluteus maximus muscle. So shorten, lock, lengthen, and then release. Shorten the gluteus maximus, lock it, lengthen it, and then release. Again, making sure it's just comfortable for you and you can apply the appropriate pressure to your client. Once again, thank you for watching our video. If you'd like to like and subscribe to our YouTube channel, that would be brilliant. And also, please do not forget to comment if there is a video you'd like to see in the future. Thank you.